This short video is a part of multiple short videos on the topic of optimizing health at any age. So if you are in the age group of 65 and beyond, then this video is for you. But if you are in any other age group, then go look for your age category. Anyway, optimizing health at any age is based upon 4 principles, and that is diet, exercise, stress management, both from internal sources as well as external sources, and sleep management. So people over the age of 65, diet is extremely important, just like any other category. What happens over the age of 65 is that all kinds of nutritional deficiencies start to settle in, and this is because a lot of people start to see problems with digestion and absorption. Also, people see a decline in their appetite. So micronutrient deficiency particularly starts to settle in. Even if people don't lose weight as a result of eating less, because their metabolism may be slower, they will start to have nutritional deficiencies. So a very well-balanced whole foods plant-based diet is highly recommended. Additional good diets are cardiometabolic diet, mito diet, and diets of that nature. But diet plan can further be individualized with the food sensitivity testing and additional tests that can tell you what type of diet you should follow. The next thing would be exercise. So this is the age group where a lot of flexibility is lost, muscle mass is lost, bone mass is lost, and osteoporosis starts to develop. So in order to prevent all of that, we need to make sure that we stay active and stay as healthy as possible. And in order to stay active and do exercise, a mix of different exercises can be done, focused on preserving all those things that are being lost. So that is going to be balance ball, Tai Chi, flexibility exercises like yoga, and there is whole body vibration, which is extremely important for osteoporosis prevention. And then of course cardio exercise can also be done to stay metabolically very active. Then there is stress management. So internal stress is going to be comprised of multiple different stresses in the body as a result of metabolism and wear and tear that is happening in the body. So we can do testing on all different levels. So the most important would be cardiovascular testing, because the cardiovascular disease remains the leading cause of morbidity and mortality in the world. So we need to make sure that we prevent cardiovascular disease, even if we don't see a problem. So even if you haven't had a heart attack or a stroke yet, it is the time to look at all those parameters. So we need to make sure that we at a minimum do cholesterol and blood pressure test, but then also do additional advanced level tests. For example, coronary artery calcium score, carotid artery screen, echocardiogram, autonomic nervous system function test, because this is the age group when people start to have problems with autonomic nervous system regulation. So they start to have problems with dizziness and they have difficulty maintaining their blood pressure. So we can do all those tests. And we can also do markers of inflammation which point to cardiovascular problem, for example homocysteine levels, C-reactive protein, and things like that. Then we need to make sure that we do metabolic testing, because this is where body's different functions or different organ functions are going to start to deteriorate. So kidney function needs to be tested, liver functions need to be checked, and things need to be looked at in terms of if there is any damage in the liver function or the kidney function or other major organ functions in the body. We also need to make sure that if people by this time, usually people know they have diabetes if they were going to develop it. So if they have it, we need to make sure that we look for complications of diabetes, because by this time, if somebody's lived with diabetes for about 5 to 10 years or longer, they have developed some complications. We need to look for all those complications and of course treat them and prevent them. Then there is hormone testing. So this is usually when almost all men, over 80%, will have low testosterone levels, and almost all women have gone through menopause. So we need to look at all the hormone levels, and if there is individual preference to supplement and correct these hormones, then that can be done after the testing is done. Hormone function or hormone balance is extremely important to maintain the quality of life, and that can be done only after testing. Then of course there is additional hormones, for example thyroid hormone, and there is cortisol levels. Those need to be tested if we are looking for optimization. Excessive amount of cortisol is going to cause problems in body's ability to deal with stress, and also low amount of or low levels of cortisol are going to do the same thing. So if the cortisol levels are very high, people start to see abnormal amount of fat accumulation around the belly, in the upper part of the neck, and all of that needs to be checked and then of course treated accordingly. Then there is gut evaluation. So we need to make sure that the gut testing is done, because a lot of functional gut problems start to arise. People have problems with digestion and absorption at this point. Pancreatic function starts to decline in this age group. So when those functions are not normal or optimal, all types of metabolic derangements and nutritional deficiencies are going to settle in. So gut testing with the help of microbiome test and the food sensitivity test can be done, and then proper treatment can be provided. Then there is nutritional evaluation. So of course we can do the amino acid, fatty acid profile. We can also do the antioxidant levels. We can check for minerals and vitamins, and all of that support can be provided after the test is done. This is usually the age group where people have started to see a decline in their cognitive function if they are already predisposed. So cognitive evaluation or testing can be done. Typically people at risk are going to be people with cardiovascular problems, people who have had a history of heart disease or stroke, people with metabolic problems, for example with history of diabetes, people with chronic virus infections, for example herpes zoster virus and other viruses, and people with the hormone imbalances, for example menopause, which almost everybody would have by this age, and then low testosterone levels, and then of course people who have genetic predisposition. So if any of those markers are present or suspected, then the testing can be done, and of course treatment can be provided accordingly. At the same time, there are additional organ systems in the body that start to see wear and tear and decline. So that is going to be the hearing problem, skin problems, problems with eyes, and then other different functions as well. So all of those things will lead to a compromise in the quality of life, and if we are trying to optimize the quality of life and optimize health, we can look at all of those things and take actions accordingly. The next thing would be the external stress. So by this time people usually have retired, but the wear and tear on the body has settled, so that can be managed. And then the last thing would be sleep. So by this time people have difficulty maintaining or initiating sleep much more frequently than the other age groups. That is because our orexin pathways in the brain and the melatonin levels in the brain are not maintained properly at this point. So if we are suspecting those problems, we can test and then of course treat accordingly. Sleep hygiene needs to be maintained. All the medications that people are taking, those need to be looked at, because beyond age 65, what happens is our metabolism is slow to the point where the end products of medications start to build up. So if, for example, if we take a medicine in the morning, it may stay there in the body in the evening also, and as a result of that, it can disturb not only metabolic functions but also sleep problems. It can affect sleep problems. So we need to make sure that we are looking at all of that as a complete profile. So therefore, whenever we are starting medications in people older than 65, we should always keep one principle in mind, and that is start low and go slow. And lastly, sleep apnea, if it's already present or suspected, should be looked at and managed accordingly to maintain good quality and quantity of sleep. And then the genetic testing again is optional, and if there is any suspicion or there are clinical markers that point to a genetic problem, the test can be done accordingly. So this is all about optimizing health at this age, at any age, but particularly in this age group. I hope it is helpful. Thank you.